Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. New York in 2026 became the first state to require private health insurers to pay for scalp cooling for chemotherapy patients. Today, I'm talking with Zeke Auburn about cooling caps. He's an oncology nurse at the Upstate Cancer Center. Welcome to the Informed Patient, Mr. Auburn.
Thank you for having me. I really appreciate you thinking of the Cancer Center.
Well, I hear this called cooling caps or cold capping. Can you describe for us what this is?
Absolutely. A cold cap is something we consider as supportive therapy. It kind of falls in a category of supportive therapy called cryotherapy. There's many types of cryotherapy out there, but here at the Upstate Cancer Center, we use scalp cooling to help reduce unwanted side effects when you're receiving chemotherapy. So to describe it, a cold cap looks like a soft shell helmet with a fluid-filled liner on the inside of it that you wear snug to your head. And after a patient will get their hair wet, prepare their scalp, they'll put that on and connect themselves to like a central water cooler. And they'll wear that throughout their IV chemo treatment, and it'll continuously deliver cold temperatures to their head. And it's only worn during the IV therapy and not something that they continue to wear when they go home.
So it's a cap, like a soft football helmet looking thing, but
It does.
it's not frozen.
Correct. Now we have some cool down times where it cools down to the desired temperature, and we have warm up times afterward where your hair slowly returns to room temperature, because it does get really cold and we want to make sure it thaws very well so you don't have any skin complications.
But did I hear you say you wet your hair beforehand? You want to go in with moist or damp?
Yeah, it really helps the cool temperature penetrate. Some people have really thick, robust hair, and it can help bring that cool temperature to the scalp when it's pre-moistened so that it actually reaches your skin instead of acting like a layer of insulation, which hair is designed for.
Well, what is the theory behind how scalp cooling works?
One of the many unwanted side effects of chemotherapy is what we call chemotherapy-induced alopecia, also known as hair loss. So cancer cells divide and multiply very fast, and chemotherapy is built to attack those quickly multiplying cells. However, we have healthy cells in our body naturally duplicate really quickly. And as an unintended consequence of that, some of these healthy cells get attacked too, and they're a victim of the chemotherapy. So when chemotherapy circulates around in the body, it can attack those hair follicles, causing thinning of the hair, in many cases, actual hair loss. Over time, research was done to see if we could do something about this side effect. We give anti-nausea medicine to prevent nausea. So what can we do to stop hair loss? And someone had the idea of cooling down your scalp to slow that down, and ended up showing some results. And cold cap therapy promotes vasoconstriction, it reduces drug uptake, and the scalp slows down hair follicle cell division. Scientifically, that's the theory.
So how effective is it at reducing or eliminating hair loss?
Well, when I speak to patients early in their journey, like when we're teaching them about the chemotherapy and before they receive it, one thing I always make a point to tell them is that every patient's unique and there's a lot of variables. There's so many different combinations of diseases, drugs. We see a high usage in females, but not limited to them, breast and ovarian cancers. But the doses are uniquely calculated. Treatments are custom tailored to their case. There's different hair types. Age has impact to it, health. But there is information and calculators out there for patients actually to look at their specific chemo and see what studies show. Another important thing is hair retention success is something that should be discussed with your oncologist, and these terms differ depending on who you ask. Using cold cap therapy can slow down hair loss, but they still can experience hair thinning. Some patients still lose their hair using the system, but for some people, cooling may help speed up the rate they actually regain their hair after they've completed chemotherapy. Some studies measure the results based on whether the patient needed to wear a hair garment or a wig by the end of their treatment. And some companies actually consider 50% or less hair loss a success. So not every person may consider that a success, but everyone's experience is really individual.
Well, are there patients who are recommended not to use scalp cooling?
Yeah, there are some cancers that aren't recommended for scalp cooling, often blood cancers, lymphoma, leukemia. There's skin cancers or other cancers that are close to the head or have high rates of spreading to your scalp or your head or your brain that doctors don't recommend. Cold cap therapy isn't really indicated for patients receiving immunotherapy, which is a big amount of the treatment that we supply here at the Cancer Center, something that we treat many patients for, but it's not an anticipated side effect. So generally, it's not indicated. So it's really important for you to talk to your doctor, your oncologist, to discuss, is this really in your best interest?
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Zeke Auburn, an oncology nurse at the Upstate Cancer Center. Now that insurers are required to cover this, do you expect more patients to make use of this, or are you hearing more questions about whether it's an option?
I think this has been a great opportunity for increasing public awareness of it. And I don't know how many patients really have had to pay something out of pocket for this service in New York, but the thought of it being a cost, honestly, is enough to scare a patient away from even thinking about using it. Honestly, I do think that there will be some increase because it's just been in the news and it really does go a long way for the ordinary patient to be thinking about that. The Upstate Cancer Center has been really fortunate to have funding from other cancer center patient funds to help cover this cost for the service. But the advantage of this legislation coming through would ideally allow those existing funds that we had been using to help out patients in other ways and support them in different directions.
I want to have you explain how the scalp cooling works at the Upstate Cancer Center. Is this something that a patient needs to ask their oncologist about, or are the oncologists likely to be the ones telling the patients this might be an option?
We get a mixture of both. It's a very common question for a patient to say, am I going to lose my hair? So it naturally comes up a lot, but the cancers that it's utilized in more frequently, they generally also bring that to their attention. They talk about their goals of care and if there's anything that they can do to help. So if there's an interest from the patient, then we can set them up and include some extra education about using this and trying to help them in another way. So it's something that providers bring up to patients. It's something that we just get a lot of natural interest for. But it's important that you do start it at the beginning of your therapy. It's not really recommended to, I'm starting to lose my hair. I'm already 3-4 cycles in or halfway through my treatment. I'm thinking about doing it now. It's most effective and study-based that you start it at the beginning.
And you also are supposed to do it every time you come for chemotherapy, right?
Correct.
How long
Yes.
does each one last?
It depends on the regimen that the oncologist decide for the patient. Depends on what kind of cancer they have. So sometimes it could just be a handful, less than 10 treatments. Sometimes it could be continuous for them for quite a while. And then once in a while they do have recurrence and they might decide to come back to it or continue it with another drug that they may end up needing.
What are the side effects of cold capping?
Well, most commonly we'll see headache. You could see headache, nausea, chills, just general discomfort. But these are pretty well managed by us. So when a patient starts feeling that, and generally it just happens in the beginning of it and for a few minutes after you're taking it off, but we can help patients out with minimal things like Tylenol, warm blankets, just comfort care while they're using it. Some patients can be attached to it for quite a long time, so it could be hours, but as short as maybe 3 or 4 hours, but sometimes like into the 7-hour range.
What have you heard from patients who have used this? Do they like it?
I've been here at the Cancer Center for a little over 9 years, so I've seen a wide range of things. I've seen patients proud and prideful of their hair and what they were able to keep through the treatment. I've also seen patients it hasn't really worked for them. I've seen some patients who are just hoping to be more discreet about their condition with either their family or at work or just the general public, and it can help them in some cases. I've seen patients whose hair actually returns a different shape, color, texture. I've also seen patients try it once and just say, this is not for me. Their hair isn't important enough for what they've experienced, and they just decide that they would rather not go through with it, that they're content with whatever happens. But what's most memorable for me seeing with these patients is just incredible determination of people who they're coming in their most weakened state sometimes, and they still have the mindset of they want to regain some level of control of their cancer and their body. And I see husbands, spouses, friends who are there to help strap on those caps, prepare it, wash their hair for them. I've seen patients on their own dealing with the equipment and just persevering through hours of cold, uncomfortable temperatures. It's not something to take lightly, and it's something that I just commend a lot of people for trying. And it's just really impressive. It's just something special that I've seen here at the Cancer Center through my career.
Well, it's really nice to know that it's an option for some patients and that it's available here. So I want to thank you for making time to tell us about it, Mr. Auburn.
Absolutely. Thanks so much again for having us and reaching out to Cancer Center, and appreciate it.
My guest has been oncology nurse Zeke Auburn. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.